We're the Utah Cancer Control Program, and we're a program within the Utah Department of Health. The Cancer Control Program is made up of 3 individual programs: the Breast and Cervical Program, the Comprehensive Cancer Program, and the Genomics Program. The Utah Cancer Control Program partners with local health departments and community clinics, healthcare professionals and hospitals, work sites, schools, and policymakers. The Utah Cancer Control Program and our partners work hard to reduce the cancer burden in Utah. We do this by working together to use evidence-based strategies to reduce cancer risk, find cancers at an early stage when they're most treatable, improve treatment, increase the number of individuals who survive cancer, and improve the quality of life for cancer survivors.
The Utah Cancer Control Program screens women between the ages of 40 and 64 who are low income, meaning about 250% of federal poverty level or below, which sounds really complicated, but we have an easy tool on our website at cancerutah.org who can help you determine whether or not you financially qualify. We also have great resources and training materials on that site. And even if a woman is uninsured or underinsured, she should still contact our program to see if she qualifies. A high deductible or having insurance that does not cover certain procedures doesn't mean a woman can't get our services. The Cancer Control Program receives the majority of our funding from the federal government through the Centers for Disease Control, and that's your taxpayer dollars at work. We also receive a substantial amount of funding from the state of Utah from our legislature. There's been a lot of confusion about the recommended screening ages for women to get mammograms. Some sites say 45, some say 50, but what we say here at the Department of Health is if you're a woman age 40 or over, talk to your doctor about what screenings you need and make sure that you talk specifically about your mammograms.
When you call the Utah Cancer Control Program toll-free hotline, you'll be greeted by one of our health program specialists who will ask you a few simple questions such as your zip code and date of birth. This will help them find services in your area closest to where you live. If you live in one of our geographical areas that we serve, we will ask you a few health and medical questions so we can enroll you in our program to receive services. We will also schedule you for an appointment with the clinic.
Breast cancer is one of the leading causes of cancer and cancer deaths in women. Breast cancer doesn't discriminate. The 2 biggest risk factors for getting breast cancer are simply being a woman and getting older. While you can't prevent breast cancer, there certainly are things that you can do to take control of your health. Getting screened is important. Mammograms can find breast cancer early, before it can be felt and when it's most easily treatable. Breast cancer caught early is often treatable. You know, I'm not gonna lie, getting screened for cancer is scary, but not getting screened doesn't mean that you won't get breast cancer. Early detection is the best way to save lives. Early detection saves lives. It could save your life.